Quincy, this is, I think we still have a lot of audience that could get in, but not everybody can speak with you afterwards. I think if anyone wants to just directly face-to-face talk to you, I will put their name into the list. And most of them, I think they can ask questions in chat or in Q&A section. Okay, I think we will start. I'm so pleased that I have the chance to introduce Professor Nino Quincy to my Chinese colleagues and the researchers and the students who work on air pollution and health relevant research. Professor Nino Quincy works at the Swiss Tropical and Public Health Institute and the University of Basel in Switzerland. Professor Quincy has a medical doctor from the University of Basel in Switzerland and got his master's in public health and a PhD from the University of California, Berkeley in the US. Professor Quincy has over 30 years record of research in air pollution and health. He worked as associate professor at the University of South California from 2002 to 2005, and as a professor at ICARIA in Barcelona from 2006 to 2009. His research focus includes ambient air pollution exposure science, epidemiology, and its integration into health impact assessment to serve policymakers. He was also engaged in teaching at the graduate, PhD, and postgraduate levels. Professor Quincy regularly serves as policy-relevant committees, such as WHO, and as president of the Swiss Federal Commission on Air Hygiene, the advisory board of the Swiss government. He served on the WHO Air Quality Guideline Development Group from 2016 to 2021. Since 2020, he has been a member of the Scientific Advisory Board of the Climate and Clean Air Coalition. He retires from the Swiss Tropical and Public Health Institute and the University of Basel end of this year. But until fall 2023, he is the Dean of the Swiss School of Public Health Foundation of 12 Swiss universities, unifying the National Virtual Faculty of Public Health Science. So this is the basic introduction of Professor Quincy, and welcome that you can give us a seminar today for air pollution and public health. Okay, it's your time. And after Professor Quincy's talk, then we're gonna have around 20 minutes Q&A section. So let's start.
Yanja, thank you so much for the invitation. It's a very big pleasure to be here with you. As you mentioned, it's almost retirement, so this is a very special year for me. I'm sitting in Basel, in the city of Basel. Outside it is very cold, unusually cold. We have even snow, which is very unusual in the city of Basel, so everybody's happy about the white snow we have outside. It's noontime, so good evening, I say, for on your end. I assume many of you are in the time zone of evening. It's a pleasure to talk about the WHO air quality guidelines today, because as Yanja mentioned, in the last 5 years, in fact, we have worked very hard on updating those guidelines. And as you will see, they pose new challenges for particularly also for policymakers around the globe. And I will like to introduce you a bit in those issues, and we can then discuss, of course, a bit the questions you might have. So, well, what are these guideline values, I think it's important we agree on what's the purpose there. The guideline values, the levels, and actually also the interim targets, we will come back to those, for these classic criteria pollutants, and also for the good practice statements for 3 types of additional pollutants. They have a very specific purpose, in essence, to identify and specify levels of air quality that we should and could consider to be healthy, in the sense that they protect human health. So this is, of course, the idea of WHO has always been that this should be based on science, yeah, and they would give guidance to the countries who would adopt those guideline values in their legal frameworks. They would give guidance on how to move toward air that can be considered healthy. So this is the context of the WHO guideline values. So they are not legally binding. WHO has no legal authority. They can just tell us what the science would promote to protect people's health. So this is the starting point, and as you see, 2005, the very last air quality guidelines were published before going into the update that we did in the last 5 years. And you see here, these are the 6 classic indicators that have been regulated or that are proposed to be regulated in the guidelines. Of course, there are many, many other pollutants, which I will not address today, but those criteria pollutants are a useful way of shaping the air quality in a way to be healthy, or at least healthier than in the past. So this is the situation. So why would we need an update? Let me give you 4 arguments, in fact, main arguments for this update. But before starting looking into that, just as a reminder that you see what happened in science in the last 30 years. When I started to move into environmental epidemiology and air pollution research in the late 1980s, 1989, in fact, we already had an office here at the Institute that would review the literature. And believe it or not, at that time, it was possible to know the entire literature, some 800 scientific papers around air pollution and health. Well, what happened today, you can easily find more than 35,000 papers on the same topic. So this literature, this science, this research has exploded. In fact, not the least also in China, but in general, in all science nations, many research groups have approached scientifically the question of the health effects of ambient air pollution. So that is, of course, a challenge and calls for updates of guidelines that are based on science. So why? Well, first, in these last 20 years or 15 years, in essence, 20 years since the last update, because those of 2005, they are based on the literature until about 2002 or so. Well, the evidence of effects, health effects of ambient air pollution has enormously grown over the last 20 years. And you see here, this is just a scheme. And I give you a link to our website where you can read more and look a bit which effects are long-term or short-term. But this is just kind of a summary graph summarizing a bit all the domains that are now subject to research, where many of those health outcomes is actually have a very strong evidence today that air pollution or some specific air pollutants or this mixture of air pollution has an impact. And this is enormous. I mean, if you look at this graph, it almost looks very similar nowadays, like what we know from the health effects of smoking. And in fact, ambient air pollution has a lot of common pollutants that you would also find in the tobacco smoke, maybe with the most important difference still that tobacco smoke is, of course, a far higher concentration on the individual level. Yeah? So if you smoke, you expose yourself to partly the same pollutants, but at far higher levels than in the ambient air. And it is even true during a smoke episode or so. But you see, this is really impressive. And if you follow this QR code, and at the end you can get my PDFs, my slides, if you like, you will find these graphs and more background information about all these various health effects. Some of those effects are short term. So if air pollution goes up today, we know from research from all over the world that today and tomorrow more people will die, more people will suffer a myocardial infarction, more people will therefore go to the hospital, and they will have strokes, they will have asthma attacks, etc. And if air pollution goes down, those health outcomes get less frequent. And many important outcomes are long-term in nature. So being exposed to air pollution during lifetime means that you have a higher risk, for example, to develop atherosclerosis or to develop lung cancer. So this is this new evidence. But actually what is very important also over the last years, 20 years, the understanding of the underlying mechanisms has drastically improved. So there is a huge research agenda, experimental research agenda, telling us a bit why all these observed effects would even happen. And of course, many of those effects are still not fully established, but we know, for example, that oxidative stress and inflammation, that this pathway is an important driver of certain effects that you can observe in these epidemiological studies. If you are interested, this is a wonderful paper of Annette Peters about the mechanisms. And in fact, if you are specifically interested in the particles, and you will hear more today also of particles, particulate matter is a very important way of characterizing air quality. Because we know that those particles are harmful if you inhale them, and you just see here how we define them by size. Yeah, so this is a very simple way of defining the mass of particle that we inhale of different sizes. So PM10 up to 10 micrometers, for example, in diameter. And if you are more interested specifically in the effects of particles and also the mechanisms, a very recent paper has just been published on the a review paper on the health effects of ambient particulate matter. Yeah, good. So this is the situation, and well, I come to a third argument why WHO has updated the air quality guidelines. So if you now go to this link, you will see this. You see this survey and this quiz. So I would like to ask you to just open your mobiles and tell me what you think. What risk factor or disease would you think is the largest cause of premature death globally today? So if you have any idea, if you have a mobile phone or something else, or you have a website open, the computer open, you can go to this website and you can find this and can click and give an answer. Does that work on your end? Maybe, well, I see one has chosen. So what do you think? Which of the 5 is the biggest, largest cause of premature death? Given that I'm not totally sure, let me see how many of you might have access or not. I give you 5 more seconds and then let me show results. Yeah, maybe it's difficult for some of you to get access, I realize. Let me show, it's open. Well, so environmental pollution, well, that's a good choice, good type. Yes, in fact, and this is amazing. you see, this is a Lancet paper, and it is still true, although this is 5 years old. Total environmental pollution is the most important cause of premature death. It's even on a global scale more important than tobacco smoke. Of course, this is very different across the globe. In Switzerland, tobacco is more important than air pollution, and you will see that soon why. But look at this. If you then split the environmental burden into 4 domains, you would also see that 2/3 of the environmental burden of disease is in fact driven by air pollution. So that is just the introduction to emphasize why WHO has decided to update their air quality guidelines, because this burden related to ambient air pollution is very large. It's not just something where you can say, well, it is scientifically interesting, but it's not very relevant. Yeah, I mean, many things are scientifically interesting, but not relevant. Well, for air pollution, that's definitely the case, that we talk about something of very, very high impact, of very high relevance. Or in other words, something where you have huge opportunities to improve health if you keep air clean. So that is why WHO has invested in this update. And now the last point, and that's the most difficult one. New studies have been published showing health effects at very low levels, indeed at levels that are clearly lower than what WHO has used as guideline values 15 years ago. So that is a key issue. So you see here the example. This type of studies were out 20 years ago to define air quality guidelines. So this is a typical, very important, large study, cohort study showing how survival, how mortality in the long term depends on your level of exposure to ambient air quality, to particles, PM2.5. So you see the air quality guideline value of 10 for PM2.5 is set almost at the very lower end of this distribution. And as you know, for particularly those who are epidemiologists down here, there is more uncertainty about the shape of this curve. That's why WHO has chosen this value of 10. Well, if you go now to the literature, you find studies like this one on the right side. Yeah. So you see here is this magic air quality guideline value, but we have data from huge cohort studies with hundreds, thousands of participants, all living at very, very low level of pollution. Well, simply because meanwhile, in many, many places of the world, and I will show you more, air quality has drastically improved. So you have many people who now belong to these cohort studies, but who have very low exposure. So you see immediately something needs to be changed with this air quality guideline value. And this is, I will come back to that, how to do that, yeah? So this question of how to update the air quality guideline values, this was a challenge we had to face as the guideline development group, because first of all, you should just be aware that WHO, of course, has also developed further in the stringency, how they want in general guidelines to be developed. So this is this has further improved over the last 20 years. So there is a high level of transparency that you have to fulfill in writing a guideline documents. It must be very systematic. It must be replicable what you propose. So this is a challenge, and this was actually one reason why it took us 5 years to work on this update. So you see, this is just the development system that the WHO requires to follow. I will not go into all details, but just that you do see there is this guideline development group down here, and that's actually the group where I was a member. There were about 40 people from all around the world, scientists who would sit in this group and write, in fact, this document. But we were, of course, reviewed externally and by WHO, so there is a steering group. So it was a very, very rigorous and very transparently and clearly defined process that ultimately led to the publishing of the new guideline values. Yeah, so this is not just the opinion of this group, but it was rigorously reviewed by scientists from all over the world. Good. So at the heart of our update were actually the 6 review articles, systematic reviews that you see listed here. They've got all published in one issue of Environmental International. If you're interested in, there is the link there. And you see 2 of them address long-term effects of 3 pollutants, and 4 studies address the short-term effects. So it was not a complete review of the entire evidence. That is not the purpose. What is sufficient is to have evidence on certain pollutants and certain outcomes, and you can use that evidence to derive guideline values, because in essence, the purpose is to protect people's health, no matter what type of health effects these are. So you see, sometimes it's asthma, in other cases, usually actually mortality is still at the center. So, well, you can go back to the same link on the mobile phone, and I will now ask you I invite you to help us to define this guideline value. So how would you, if you see this graph on the left side again, it's the same I've shown you. Well, where would you now draw this magic new line that WHO should propose as an air quality guideline value to protect people's health for PM2.5? Any idea? What would you propose if that is the science? And I can tell you that is an example of a huge science that leads actually to this challenging question. What is this new magic value you would promote based on such a graph? Yeah. So 2 people have responded, maybe a few more, 5 more seconds. Yeah. Or you just write it on your own paper, and I will show you the response. Well, 3 have responded. Okay. Good. You see, you have disagreements. And of course, that's why we took quite several meetings, and it took us quite some time to come up with a concept to derive these new numbers and have agreement. Yeah. So you see, yeah, some would argue for 0, for 5, for 7.5. And of course, I'm sure if I give you the microphone, you would have explanations why you do that. Yeah. So this is what we faced as a challenge. And what I show you here, using again PM2.5 as the only example, what we decided, we took all the studies, and in this case, these were 7 studies, where large cohort studies with participants who experience very low exposure to ambient air quality, air pollution at their residential address. Yeah. So as you may know, all these cohort studies today, they work with an estimate of the air quality at the residence. So we took those 7 studies and we decided to pick the 5th percentile of the distribution of air quality, home outdoors, in those populations. So again, as you see, we do not choose the lowest value, but the 5th percentile, because as the epidemiologists among you would know and agree, at the 5th percentile of the distribution, one can be pretty sure that this association concentration response function is solid, whereas at the very, very beginning, you see down here on the left side, you might have more hesitation to say, well, we are totally sure that this is the shape of this response function. So that's why we chose the 5th percentile. And if you go through that exercise, you take the mean of all those, and we did, of course, a little bit of rounding because it doesn't make sense to promote a guideline value of, I don't know, 4.97 or so. So it was this new value promoted to be 5. I show you just here the example of how it looks with the NO2. Yeah, NO2, you have also a huge literature. And again, you see here this challenge with the old air quality guideline being the red line, yeah, and finding now this literature showing us this association almost, but not entirely, down to 0. So the new air quality guideline value for the annual mean proposed by WHO is now set at 10 and not at 40 anymore. Yeah. So you see here, this is now the overview, the full table of all the guideline values that are now promoted. And as you see here, ITs, these are the interim targets. So WHO has kept the same interim targets as in the past, and the last 2005 guideline values have now become the new interim target 4. Yeah, and of course the interim targets are there for countries with very extremely high pollution, in at least in the mega cities, like for example in China, that they can have a plan for air quality management in saying, well, within the next 5 years we want to reach IT2, and then we move to IT3, IT4, etc., prior to reach the air quality guideline level. So this is just a way of staggering a bit the policy making. Yeah, so that is what you find written up in the air quality guideline book. Just to briefly mention you, we had written 3 good practice statements also, so for black carbon and also for ultrafine particles and sand and dust storm. So you don't find air quality guideline values for those. Well, we of course discussed whether to promote guideline values or not. And just to emphasize here the ultrafine particles, why did we not promote a guideline value? It's simply because it's not a health, it's not uncertain in terms of health effects. We do know from quite a very important and large science that ultrafines are not good. They have adverse health effects, but there are no international measurement standards how to measure ultrafines, and that is a problem. You cannot promote a guideline value if there is no way to measure it in a standardized way for the monitoring. But let me emphasize that from a Swiss perspective, as you know, I'm the chair of this commission that advises the Swiss government how to regulate air quality. You can regulate air quality also without guideline, without limit values. Yeah, it's not the only way to make progress. And in fact, Switzerland measures the ultrafine since many years, although we have no guideline, no limit value defined. And in fact, they do monitor it. And what we see, this is an example over the last 20 or 15 years, as you see in all types of stations, particularly also along a highway, we see strong improvement. So there is a downward trend. So as long as we see this, it is not an absolute necessity to have a limit value, yeah, but one can monitor and one can have policies that address these problems anyway without the predefined limit value. Well, leaving Switzerland and looking a bit more to the global level, you see these new air quality guideline levels proposed by WHO. They are a huge challenge for policymakers. And what you see here is just examples around the globe of the trends. And this is now just PM2.5, the fine particulate matter. You see levels are drastically different around the globe, with many regions with very, very high levels still. And actually many of these trends are even going in the wrong direction. Yeah? And that is, of course, a problem. Yeah. So what we do know, we need, there is absolute need to make a change. We need changes going on in many regions of the world to stop the deterioration of air quality. And we need additional efforts also in the Western countries to achieve these new air quality guideline values, because they are really much lower. And I show you now just a few examples from Switzerland, given that's where I'm sitting right now. So you see PM2.5, we have a very very strong history of improvement. So currently all our monitoring stations, almost all of them have reached, in fact, the national standard, which is based on the old WHO guideline value, but it's a challenge now to reach the air quality guideline level as proposed by WHO, this new value of 5. And you see here the distribution of compliances of our 70 monitoring stations in Switzerland. So you see very few, in fact, only one monitor in a very remote rural site in the Alps already would comply with this new value. Well, if this would become the limit value in Switzerland, that would be a challenge for all those other stations. They are not in compliance, but you see only 14 monitors are not in compliance with the current limit values. Yeah. And this is just another example of the trends in Switzerland. So you see here the NO2, nitrogen dioxides. We see the same strong trend toward improvements since many years. And you see the challenge to reach the current standard. Yes, we have reached that. We are in compliance with the old WHO values, which are our legally binding limit values in the law, but we are not yet down at the new air quality guideline value. And you see the same distribution here of the stations that comply with, and I'm not going into the detail here. Yeah. So let's leave Switzerland and look a bit more globally. Well, you see here the tragedy and the challenge. Many countries are still not at all lined up with the WHO air quality guideline, not even the old ones. I mean, not to speak about the new ones, but not even the new ones. Many regions do not regulate air quality at all. Many regions have even no air quality guidelines or only for very few pollutants, and most of the regions have set them far too high. So that is a problem. Actually, for WHO, they don't have a crisis in publishing their air quality guidelines. Even the old ones would still be very valid, but the problem is that many ministers of health or ministers of the environment of many countries in the world are ignorant against this call for clean air. And you see here an example, again, just for the particles. As you see here, there are a few in the green or yellow zone, which have already adopted at least the 2005 WHO values, of course, not yet the new ones. But then you have this very troublesome European Union who has opposed since 20 years to adopt in their directive limit values that are in line with the public health needs. And this is very absurd, because the European Union has funded many of these very large and successful studies showing actually that health effects occur even at very low levels. So now the European Union has decided to move forward. They have waited to see the WHO update, and very recently in October, they have decided to propose changes here, but they are not yet made. And if they are successful, those proposals, they might move in the direction of at least of the 2005 values, if not below. And of course, as you see in China, where, as you know better than I, in many mega cities of China, you have very high pollution. So the legal framework there has still adopted the interim targets as a first step to move forward toward cleaner air. Yeah, this is the other example, PM10 in Switzerland. You see, until now, as mentioned before, actually, we are really compliant with the old values, but still not yet with the new ones. Let me just be clear, because many people have not even realized that it's not just in Switzerland or in Western Europe. In many countries, we have seen a lot of progress in the last 30 years. So that is very good news, and it tells us, it shows, it proves that it is possible to have clean air, or cleaner air. And of course, these countries still move in the right direction, but this is not universally true. And I don't have to tell you that actually in China, in many regions of Asia, these lines go in the other direction. Still, I mean, maybe in China, in some cities, it's coming down now a little bit, but from very, very high levels. And in many regions in Africa and South America, you still see wrong trends. And that is, of course, absolutely important that we emphasize this. We should at least make sure that all countries go on the right track of improvements. So this could happen, and this of course depends on policies. So if you look here, these are graphs in for different regions of the world, and you might be interested in the orange line here, which is China. These are the emissions. And if you have emissions of pollutants, and you see here some examples, if they are too high, of course, ambient air quality cannot be good. And you see these very high emissions of nitrogens, of CO, or of black carbon down here. I mean, these are terribly nasty pollutants. And if the emissions are so high, of course, you have a problem with ambient air quality. So regulating the emissions is actually a very crucial step in the legal framework. So you need very strong regulations, limit values that limit the pollution that comes out of chimneys, of cars, of tailpipes, and you name it. And of course, the nice thing is this is all possible. So the technology is available. I mean, you would never see a ship like this on a Swiss lake. Simply not. It's inexistent because it's forbidden, and the technology is there for ships to be very clean. And this bus here, a picture I took many years ago in California, you would never ever seen such a bus in Switzerland, and today you wouldn't see any bus like this anymore in California. I mean, such a bus produces pollution like several thousand of modern cars. And this is, of course, a no-go, and it needs strong laws. And you see here the trains. I mean, trains who are still running on the diesel is a no-go. They should be electrified, and this is in the train station of Paris, if I remember well. So you see, there is emissions that need to be tackled. So why do we actually, from a science perspective, why do we call for keeping clean air or keeping the air clean? Well, health is, of course, the topic I have addressed now with you, and it is on my research heart since more than 30 years. But just as a reminder, in many countries, other reasons are even written in the law that force policymakers to keep clean air. And this is, for example, visibility. So visibility is an important aspect of the beauty of nature, of well-being. Then, of course, health, but crops. I mean, many of the large crops get damaged, like soya or wheat or others, by some of those pollutants. Buildings get damaged, which comes with a lot of costs and of course related economic losses. So air pollution is also economically the wrong choice. We should, from an economic perspective, reduce air pollution to the best ever possible way. And how is it? How should we do it? Of course, you need legal frameworks. You need very stringent emission standards, which I already mentioned, and you need science-based ambient air quality standards. Because if you don't put the right targets, of course, those in charge of taking care of the air quality on the local level, they will not reach the right targets if you set the wrong targets. So you need to be ambitious, and you should say, well, legally we should have the WHO air quality guideline values in our laws, so let's try to get there. And of course, in a highly polluted area you need more time than in a less polluted area, but it is not a good idea what the European Union did. They have put a particle standard far too high, and that takes off the efforts on the local level actually to do what could be done and what other countries actually have done. And you need management plans to really make a change. And of course, it's very important to those management plans. You cannot copy paste the management plan of Switzerland and assign it to Beijing or Nanjing or wherever, yeah, because you need to look at the local situation, the local problems, the local needs, and come up with management plans that actually are tailored to those needs. Yeah, and I have shown all these sources in the last slide. And as you know, some sources are not relevant in some areas. For example, in Switzerland, you would never ever have people burning trash outdoors, but in many, many countries, that's what happens. And of course, if you burn trash just outdoors in your garden, you create a lot of air pollution. So you need laws and management plans, according ones. Yeah, and if you ask me, this is kind of my last message to you. I really strongly believe, meanwhile, after all these years of doing research and of advising also policymakers, we need a globalization of the regulations. Without globalized standards, we will not be able to get the problem resolved. We need, because what actually happens, and you find a huge literature on there, if you have unequal standards, what of course globalized companies do, they just sell the dirtiest possible technology to those countries which still allow those technologies. And I could make you many examples also from Swiss companies and from other companies exporting dirty cars, dirty fuels, etc., to places where this is still allowed, although they create a lot of air pollution and although they are forbidden to be used in Switzerland, in Germany, and you name it, or all over Europe. So we need globalized emission standards and we need globalized ambient air quality standards, so all the nations together can make the same efforts to achieve the goals, rather than try to outsource the problem to other countries just because their governments have not yet addressed the problem. And that's really what happens. I mean, outsourcing of air pollution is something that many, many Western countries did in the last 20 years, including Switzerland. And this is another reason why we have seen so much improvements in our country, but very big deteriorations in countries where we have outsourced the problem, such as in Asia or in Africa. Yeah, this is my last slide. Just in sum, I hope you have realized that scientific evidence forced WHO to publish new guideline values, and that's what we did. And it's really my very strong belief and opinion that authorities should use the science in the way to manage their air quality, to set standards that are science-based, and then to come up with smart clean air management plans. And we might agree that you need globalized efforts to really make progress, not just in a few countries, but everywhere. Yeah, so I thank you for your attention, and I'm happy to answer questions, whatever you would like to address. Yeah.
Thank you so much, Professor Quinsley. That is a great talk. I think next section that we can start the QR section. And I bet there are some questions here. Okay. This is Professor Clive Sable. He mentioned a question here. Thanks for a super talk, Nino. Can you comment on two aspects? These guidelines, I think, are for either 24 hours or annual average of outdoor air at fixed monitoring sites. The first one is, how do you think indoor levels should be related to the new outdoor guidelines? The second? Okay, maybe you can say something about the indoor levels first.
Well, that is a very good question. Let me say the following. In Switzerland and in most countries, the regulation of indoor and outdoor is completely independent. And in fact, regulating indoor air quality in the private homes, at least in my country, is impossible. So no policymaker would ever adopt a law that regulates my air quality beyond, let's say, we have laws that regulate the material. So materials should not emit nasty pollutants. But I mean, these ambient air pollutants, of course, they move indoors. So we inhale those also from outdoors. And there is no way to regulate that formally. Of course, what we do know is that those pollutants have effects. So it's a good idea to take also care of your indoor air quality. And in fact, some of the policies, like it's forbidden now to smoke indoors, at least in public places indoors, that is very useful, because indoor smoking creates a lot of these very nasty particles and other pollutants. So that is a solution. Or of course, having in large buildings, having ventilation systems that would also filter out the dirty air that might even come from outdoors. This is a good idea, but at least in my country, there is no way to really have policies on that. And of course, the indoor air is very much dependent on what you have outdoors. So it's important that we regulate first and foremost the outdoor air, because that also helps to keep indoor cleaner. But of course, people should know that they have there are many ways to create a very dirty indoor air. You as an individual, you can have many choices that make your indoor air poor, and that is something you should take care of.
Yeah, good. The second one is the guidelines are for places, not for people. So as we know, people move through daily lives. I wonder if WHO can move towards personal guidelines as well.
Well, this is a very interesting question. And of course, the moving is partly addressed in the science that tells us what these effects are. Actually, if you look into the ideas of the air quality guidelines of the regulation, and if you look into some laws, I don't know the Chinese laws, but in my country, our environmental law says that everywhere air quality must be in line with a quality that does not damage people's health, and even the health of the most sensitive people. So we, by law, we must comply with these limit values everywhere. So we do not have places where you could say, well, here people are just passing short time during their commute, so this street here can be very dirty. No, it has to comply everywhere, and that's why we are not actually just regulating the sites, but of course the monitors stay on a certain site, and actually we choose monitor sites in a way to cover the full range of possible pollution. Yeah, but air quality should comply with the limit values everywhere, outdoors.
Yeah, that is true. But I think in China, I think indoor air, I didn't see so many buildings that we have the air clean system inside. So I guess that is also a problem.
Yes,
not like
yes,
in
no.
Switzerland, everywhere the air quality is the same.
No, you're absolutely right. It is a problem, and it should be addressed by health ministries. And of course, there are certain ways of finding solutions to improve that. But it is definitely a huge problem. And I did not talk about, but in some regions, also in China, people are still cooking indoors with combustion.
Yes.
Yeah, dirty combustion. And of course, this is a huge problem. Like in India and in many places in Africa, there, the mothers and their children, they are exposed to very high levels with of course the same type of impacts. Yeah, so this is needs to be resolved also, particularly because these so-called indoor combustion creates a lot of pollution outdoors. Yeah, I mean this is very dirty combustion, and of course in such communities you also have a poor outdoor air quality because of all this indoor burning, yeah, biomass burning.
Good, thank you. So next one, Min, I think maybe you want to ask some questions here.
Oh, hello, Dr. Consley. I have a question for the monitoring sites. Actually, to meet these guidelines, one way is to eliminate the emissions. But the other way the policymakers usually do, especially in China, is moving the monitoring sites far away from the emissions, or even they can move the monitoring site into a national park. So does WHO has a global standard for the monitoring site location chosen, selection, and how many sites are suitable for mega cities such as Shanghai?
Well, that is a very, very good question. Well, of course, the guideline values do not talk about how to go those avenues. There are, of course, other international commissions who have written guidelines and protocols how to monitor air quality in a country. And of course, what you are mentioning, to move a monitor just to a clean air, to not know how terrible it is along the street, that is, of course, not the way how we should do it. And of course, this does not happen only in China. I remember 2 years, 3 years ago, we had these absurd discussions in Germany where some German agencies actually did that. Yeah. So because actually, I have to tell you, the European Union has the directive. And the problem in the European Union legalization is if you are not compliant with those values after a certain time, you have to pay penalty. So of course, it might be a solution to move your monitor away from a very bad place so you don't have to pay. The Swiss law does not have such penalties. So we are more relaxed in saying, well, this is the target, we should reach it, maybe in 5 years, maybe in 3 years or in 15 years, just try the best you can do, but there are no penalties. So we have no incentives. Our authorities have absolutely no incentives even to move or to discuss that. But what they do, you should place your monitors in different types of settings so that you do know how is air quality in the background, how is it at the worst place, at very close to emissions, because this helps you to steer the policies and it helps you to actually also monitor and show improvements. Yeah, and improvements might be faster and more impressive on a very dirty street rather than in the background station. But you should try to find solutions where you have improvements everywhere. So your last question, how many monitors do you need? Well, honestly, I think one can do a pretty good job with a limited number of monitors. I think as long, and the local authorities and scientists would of course know, I think you should just capture a few typical locations where people would agree, well, this is really one of our dirtiest places where people move through, where people live. So you want to know that, but you also want to know something that people would agree to be considered a clean background station. Yeah, maybe in some neighborhood where people are just living, but there is no industry, etc. So I think you would pick smartly to cover the full range, but it's not a necessity to have hundreds of monitoring stations only because the city is big. Yeah.
I agree with that. That's good for the people, but sometimes it's not good for the policymakers to keep their positions in the government. Just kidding. I have another question. Well, to meet these guideline values, I see the latest values are very, very strict, such as particle matter 2.5 is 5, and ozone is, I don't remember that, but how about the nature emissions? Some researchers studies already shown that the nature emissions can cause high concentrations of ozone or even aerosols, such as a country near the coastline or an island country, they can meet very high concentrations of nature from nature sources.
Yeah. Very good. Let me maybe just add one point to your very last other comment. It's about people or about the government. Of course, clean air policy making is for people. And the interesting thing with policy discussions for air pollution, of course, the government are also people. And these people live somewhere. And what is really interesting to see in many, many big cities, those people as private people, they live in very, very dirty places and it stinks and they don't like it. So this actually helps that governments and people, what you say, pull on the same string, so that they agree we need to improve because they are all affected. You cannot evade air pollution. I mean, if you live in Delhi, you live in Delhi and you just go through suffering through these terrible situations. But your other question about natural emissions, that is a very good point. And again, you need to address policies from a local perspective. In my countries, natural emissions are not an issue. Occasionally, we have Sahara dust, and this might add very few micrograms per cubic meter to our very low particle levels. But there are places, and you see that in the guideline values, for example, in the chapter on desert dust. I mean, some places have enormous exposure during dust storms, and you need this local policy discussions. And actually, one thing we did discuss also in the WHO guideline value group, of course, places where you have very strong natural emissions, typically they are occasionally there and not always, it might be very good to let the scientists help you monitor air quality in distinguishing it by the source. It is possible to know the source specific particles, for example. Yeah, I mean, you could know which particles come from the desert dust versus just from anthropogenic activities, because such monitoring could actually help showing people that at least the anthropogenic problem has been resolved by or gets better and better. Yeah, and then you have this other problem, and you can better communicate that and say, well, look, yes, our anthropogenic pollution has really gone down because of our policies, but we still have desert dust. Yeah, and of course, desert dust needs other discussions, other solutions. They are for sure far less less easy than handling pollution from cars, etc. So I think this distinguishing this might be helpful for these local discussions on policy making. Yeah.
Thank you so much for these two answers.
A good discussion. Maybe Ming, in the future you can keep talking to Professor Quinsley, and maybe he can give you some good advice for research or fundings, whatever.
Sure. Dr. Quinsley, can you give us your email address?
Sure. It's actually on my slides, and Yancha would know it. It's
I will
easy.
pass
I see. Yeah.
It's my name with TPH. Yeah. Good.
Yeah, it was blocked by the Zoom software itself. Let me find a way to show it.
Okay, great. I think we still have several more minutes. And Xingkai, are you here? And maybe you want to say something to Professor Quinsley? Hello? Well, he didn't answer me, but he wrote his question here that I can read it.
Wait.
Are you here? Okay. Okay, you can talk now. Okay, keep going.
Wait.
Yeah, I can hear you.
可以。
I can hear you. Keep talking.
喂
Oh.
喂，
I can hear you. Keep talking. Something wrong? Let me see. Maybe something.
We don't hear.
Oh. Okay, maybe there's a problem. Well, I can read the first question. So I noticed that for NO2, a new index for annual was entered in 2021. Air quality guideline fails compared to 1987. I wonder if the index are changing as the environmental pollution changes.
So do I understand it correctly? This is more a question related to the air quality index.
Yeah, for NO2.
So this is not about the air quality guideline values or the limit values. It's more this index which translates the levels of pollution into easy number and then the color. Is that what you refer to? So the index is usually from 1 to 10, and on every day, some authorities would say, well, today it's number 2, which is green, and that relates to the single pollutants. I don't know, is that the question related to the air quality index, or are you talking about the limit values?
Well, Xinkai, are you here? No, maybe I will ask him later on. So let's see another one. I really appreciate the thought that the assessment system of air quality guidelines, but maybe the standards are hard to be globalized, as the examples that you said, cars use diesels and other air pollutants problems in different countries.
Well, of course, I appreciate this comment. Yes, these values are very tough now, and they just show us on the silver plate what's happening around the globe. And what happened is a huge inequity in the way air pollution occurs or gets limited by good policy making. I mean, diesel is a wonderful example. I can tell you that policymakers have a strong effect. I tell you, Switzerland is surrounded by the European Union.
Yeah.
Switzerland, for health reasons, in the last 25 years, has never agreed to promote diesel. So our diesel, the price for diesel has never been subsidized or promoted in a way that it was cheaper to buy diesel rather than gasoline. Simply because 20 years ago, the diesel was so terribly dirty. However, the European Union, Germany, Italy, France, the very big automobile making industries, they did not want to block the diesel. So they have promoted diesel by the law in the way they have put the prices. And you see that still today. Of course, nowadays, the diesel cars have become very, very, very clean cars. But even 10 years and of course 20 years ago, this was not true. But France, Germany, Italy, they have promoted diesel and they got what they promoted. They got huge fleets, 40, 50, 60% of their car fleet, very dirty diesel cars without the particle filter. Yes, you get what you want. It's very easy. And what I told you, in Switzerland, we did not do that because it was not interesting for the customers to do that. So the diesel cars in Switzerland have only taken up once the filters became available. And now we have also, I don't know, 30, 40% diesel cars. And there's no difference anymore in terms of pollution of the two types of cars. But that's how you can steer air quality. And all I'm saying is this should be science-based and it should be targeting public health rather than the interests of a few car makers. And of course, that is easier to say, but as a scientist, I'm sorry, I have to say that. And we are not saying that achieving the goal of the WHO air quality guidelines is easy, but it is possible.
Yeah. Okay, the first question that I mentioned for Xinkai, and he said for the NO2, which is he questioned in the air quality guidelines. So it's changing from 1987 to 2021. And he's wondering that if in the future this index will change, keep changing based on the environmental pollution changes in the air quality guidelines. I think that's what he means.
Well, honestly, I'm not totally sure. I mean, the point is WHO publishes just the air quality guidelines, and I have shown you the 4 books they have published, and that's it. But of course, what happens on the national level in terms of legal frameworks, policy making, setting standards, of course, countries have adopted new standards independently of WHO, and most countries would move toward what WHO has proposed. Yeah, so that is maybe behind that question, but because I'm not aware of specific changes, but definitely the air quality guideline for NO2 has come down for the same reasons mentioned before, because now we have this huge scientific evidence from all around the globe on NO2 and its impacts, which was not the case in the 1980s and 90s.
Yeah. Okay. Thank you so much, Professor Quinsley. I think you did give us a very interesting and a fantastic talk. There's a problem in my campus, I think, and my students told me that they didn't have electricity. So there's a problem for electricity. So that is why they couldn't get into this Zoom. So,
okay.
But I will send your PDF to them afterwards.
That's fine. I will send it to you very soon. And thanks a lot. I hope electricity is coming back. As you know, we also discuss about the electricity problems. So far, they have not happened, and the authorities prepared what to do if it happens. But let's hope for the good. Yeah.
I hope this is just maybe a mistake or something, not because of the energy problem.
Good.
Okay. So thank you so much. I think afterward, Ming will contact you.
Thank you. And enjoy the last days of the year. Yeah.
That's the day of the year.
Well, we have about 20 days left.
Soon it's coming.
Yeah.
Well, our year, the 2022, will end in about 20 days.
Yeah. Okay, I think we can stop now. Thank you again, Professor Quinsley. So see you later.
Thank you, Yancha. Thank you, Clive. Also, see you. Have a nice day. Thanks a lot. Bye.
Nino.
Thank you, Nino.
You're welcome, Clive. Take care.
Happy retirement.
Yes, thank you. Stepwise.
I'll contact you in Switzerland. Don't worry. I'll be looking forward to seeing you.
Very good.
Thank you. Bye-bye.
Bye-bye. Thank you.
信松，你太晚了，你有电了这会儿？
我刚登上来，我刚准备问问题，然后就
下一次的话，你可以把问题写进来。
我一定要必须要说出来。
He doesn't really have a question.
我刚准备问问题，停电了这边。
学校怎么会停电？
不是停电，是停网，然后。
没事。我把邮箱发给你啊，小明。
他已经发给我了。
啊，在家吗？
嗯哼，
你在家吗？
在啊。
嗯
With my kiddo.
嗯
With my kiddo.
哦
With my daughter.
I can't
You wanna-
see her.
You
Yeah,
wanna
I'd
see
like
her?
to see her. Yes, yeah. I really
Let
want
me
to.
let me grab her here. Wait a moment.
Yeah, you don't have video.
Oh, oh. Okay, let's see.
Oh, cool. Okay, I can see. Oh, that's nice. Oh, hi.
Hello.
Hi, let's go.
Say hello. Say hello. Come on.
Oh,
Oh my God.
that's nice.
That's great. What's her name? Do you know
Felicia.
her name?
Felicia. Yeah, Felicia.
What a-
Oh my God.
Yeah, that's very cute.
Oh my God. When are you coming back?
20s. If
Oh.
everything gonna be fine. Yeah. And 21st.
Just a week left.
Technically.
Well, have your last days
yes.
in Switzerland. Is
Yeah.
that Switzerland?
Denmark. Denmark.
Oh, Denmark.
Yeah.
Denmark. Okay. I will leave her to her mom. See you. Bye.
Bye-bye.
Okay, bye.
Bye-bye. Thank you.
Bye-bye.
Yeah,
Thank you.
thanks for organizing.
Okay.
Yeah, bye-bye.
Nice to see you
Bye.
again, Clive.
So, yeah.
Yeah, I'd like to
See
see
you
you.
soon. Yeah.
Bye. Bye.
Bye. 哎，徐老师，这就可以结束了是吧？
都走了，都走了。
都走了，那我们就可以下线了。
可以。
行，那你那个一会儿我再给你打电话吧。
啊，行，好的，我现在在办公室。
拜拜。
好的，再见。